Thank you, Dr. Leary. Thank you to you and to everybody here that has made it possible for us to be with you. My heart is overflowing being here. I'm especially touched to be returning to my alma mater. My father, Charles Hayward, who was the art professor here from 1969 to 1987, is here, as you just heard, as is my mom, Irene, and other good friends from the community where I grew up. And it is just so meaningful to me to have them here joining us tonight. I'm so happy to be acquainted with all of you and to have this opportunity to get to know Bay Path now. On the surface, it looks like a very different Bay Path. For one thing, Bay Path grew up. When I was here, it was a junior college, and now it's a university. It has 9 campuses. I spent my Bay Path years in Longmeadow, and here we are in this gorgeous new space here in East Longmeadow. As Dr. Leary said, if this is your first time in this building, please make sure that after our gathering, you speak with a Bay Path representative and arrange a tour and find out how you can become part of this extraordinary learning community. The greater Springfield community will benefit tremendously by investing in and supporting this jewel that shines here in Massachusetts. For David and me, this day has been very special, full of rich conversations that both of us hold very close to our hearts. Being here has allowed us to dig below the surface, and we have found out that the things about Bay Path that I cherished 40 years ago are still here. The love of learning, the curiosity, the creativity, the passion, the focus on excellence in education, but above all, the kindness in every conversation, in every casual glance, in every handshake, the kindness. It feels very good and very familiar. This university, under the visionary leadership of President Leary and her team, has been making decisions in the present that are paving the way for the future. For the students studying the service arts, like education and health, starting careers with a firm foundation is key. You have chosen to emphasize areas of study that have wide potential. Expertise in teaching, in mental health, physician assistant skills, occupational therapy. These will serve you well. This education offers years of stimulating professional experiences and the fulfillment of helping many people in need of service. Entering the service fields right now is complicated. It's a time of tremendous transition in both education and medicine. There's a lot of pressure, a changing landscape, and enormous bureaucracy. All of us, especially those in the service professions, need a daily personal health and wellness practice. Stress is a real issue for everyone in modern life. Burnout is a real problem in the service professions. You've probably heard the old adage that when the airplane oxygen systems fail and the oxygen masks appear, you're supposed to put one on yourself before you help those around you. To be present for others and their educational and healing processes, we have to be present for ourselves first. As Dr. Leary told you, I started out in conventional medicine. Then my patients and our children beckoned me toward experiences that broadened my horizons beyond what conventional medicine was offering at the time. When I was at BayPath 40 years ago, there was no BayPath website. I love that this is on today's website. We can't know what all the hottest jobs of the future will be, but we do know that flexibility, adaptability, and hands-on learning will make you more than ready for them and for anything else the world might throw at you. For anything else the world might throw at you. I have learned that important information comes to you when you least expect it, when you are not looking, when your guard is down. The last thing that David and I expected was that our 5-year-old daughter would insist on never again eating something that had lived, breathed, had a face, or a mother. The last thing I expected during my medical residency was that a patient would accuse me of malpractice because I did not tell him that acupuncture would help his heel spur. Yes, it's true. Does anyone here know what a heel spur is? Can you please tell us what a heel spur is?
It's an extremely painful condition. It goes along with plantar fasciitis often, but it's extremely painful. And as on your website, cortisone injections do not cure it. Now let's move on from there.
Yeah, it's a bony growth at the base of the heel, and it hurts to walk. So this was a stressed out executive I was taking care of, and he was a runner. You know this guy. Maybe you are this guy. He had to run to manage his stress. So he kept running. I did the things that I had learned in conventional medicine to do for him. Ice, heat, rest, anti-inflammatory medications, sent him to a specialist in orthopedic so that he could have cortisone injections. He kept running. His opposite hip started to hurt. He got more and more grouchy. I began to dread his office visits. And then one day he walked into my office with no limp. And that is when he said, "I ought to sue you for malpractice." Why? You did not tell me that acupuncture would cure my pain. I could have gotten defensive. I could have dismissed as coincidence his acupuncture treatment and the improvement in his pain. But instead, after he left my office, I picked up the phone and called the local acupuncture school and said, "I'm an internist. I've just had a humbling experience. Is there somebody there that can teach me what acupuncture can do for my patients?" They connected me with the dean of the acupuncture school, a Chinese physician who decided not to go through the American residency accreditation process and had opened an acupuncture practice in Chestnut Hill. And I spent a day with him. And that day changed my life. How many people have heard the term conventional medicine? How many people have heard the term complementary and alternative medicine? How about the term integrative medicine? Okay. The students at BayPath University are entering the medical field a few decades later than I did. A lot has changed in a short period of time. Thanks to Dr. Andrew Weil and other pioneers, there is now an actual specialty of medicine called integrative medicine, with residencies, fellowships, and board certification processes. A gathering like this would never have happened in my medical school in the early 1980s, before these pioneers expanded the boundaries of the conventional medicine system. So Andrew Weil says that integrative medicine is a partnership between patient and practitioner in the healing process. It's an appropriate use of conventional and alternative methods to facilitate the body's innate healing response. It is a consideration of all factors that influence health, wellness, and disease, including mind, spirit, community, as well as body. It's a philosophy that neither rejects conventional medicine nor accepts alternative therapies uncritically. It's a recognition that good medicine should be based in good science, be inquiry-driven, and be open to new paradigms. The use of natural, effective, and less invasive interventions whenever possible is supported. The use of the broader concepts of promotion of health and prevention of illness, as well as the treatment of disease, is supported. Training of practitioners to be models of health and healing, committed to the process of self-exploration and self-development. So as President Leary told you, we used to live in Boston, and now we live on the island of Mallorca in Spain, where we are grateful to no longer have to shovel snow in April. We've been thinking about health themes for most of our lives, and in 2013, with a group of like-minded colleagues, we created International Integrators, an organization whose mission is to promote integrative health globally. In International Integrators, we use the term integrative health instead of Dr. Weil's term integrative medicine. This reflects our desire to broaden the discussion even further. The term medicine brings forth images of people trained as doctors, nurses, PAs, OTs, and others in the conventional medicine system. And for some people trained in other healing arts, the term medicine feels like it excludes them. The word health is more inclusive and more expansive. It carries a connotation of prevention, of being proactive, of balance, of harmony. And we like that message. When we talk with people about integrative health, one question we love to ask is, why are you interested in an integrative approach to your health challenges? Then the stories start to tumble forth. I'm sure that this room has a few of these stories, and I hope that we can hear some of them tonight. Please raise your hand if you have a doctor. Please raise your other hand if you have more than one doctor. Do you mind answering a question? If you could just name the specialties of your various doctors. Physiatrist.
And just general medicine.
A general medicine internist. Okay. Who else has more than one doctor? You do? What are the specialties of your doctors? Endocrinologist, cardiologist, podiatrist, general practitioner, OBGYN, and a few others that you've forgotten. So I'm going to put forth that you named us 5 specialties. I'm going to put forth that you have 6 people on your healthcare team. Oh, naturopathic, so now you have 7. And you gave us 2 specialties. I'm going to put forth that you have 3 people on your healthcare team. Now, why am I saying that? You guys are so good. Yeah. Have you ever thought of yourself as an essential member of your healthcare team? I'm seeing some nods. I'm so glad. If you hesitated, or if this is a new idea for you, you're in good company. It's an important shift in many people's attitudes to think of ourselves as essential to our health teams. Instead of seeing ourselves as an integral member of our health team, many of us regard others as having more power than we do when it comes to our medical care. Whether they're doctors or other healthcare professionals, we regard them as being in positions of authority. It's a model that's worth looking at and asking whether it's working for us as a model. So tonight we can explore some alternatives to that model. Consider this. There's more than conventional medicine out there. There are things that can be helpful to our health that we didn't necessarily grow up knowing about, or we don't necessarily think about. And many of them are things that we can do for ourselves to improve our health. Think of this as a both-and model. In an integrative health model, conventional medicine has its place, and we have an important place too. Our place is guided by our attitudes and our beliefs. When we regard ourselves as having power to affect our own health and see that we're capable of taking care of our own health, that is the most powerful treatment of all. Here are some definitions of doctor from the Merriam-Webster Dictionary. Let's put the words I am before each definition. And let's say this out loud together. I am a learned teacher. I am a person skilled in healing arts. I am a person who restores, repairs, or fine-tunes things. The doctor is in here. I am my own doctor. I teach myself. I develop skills in healing myself. I restore, repair, and fine-tune my health. I may partner with others to help me learn skills that I need, or I may receive care that they're trained to give. While doing so, I acknowledge that the power is right here within me to be the motivating force in my health journey. Here is how we see it. Building on the creations of Dr. Weil and those other integrative medicine pioneers, we define integrative health as bringing together the best in conventional medicine, food, movement, and mind-body-spirit disciplines. This image was made by Jack Temple, who co-founded International Integrators with us when he was a medical student. You can see that it is made up of two intertwined infinity signs. When David and I first saw this image that Jack created, we saw themes of light and balance and harmony reflected in the model, and that really appealed to us. We saw the light in the center as representing the light that is within each of us, powering our journeys, our choices, our life experiences. And we saw the lights in the periphery as representing pathways that invite each of us to move toward the center. The symmetry and elegance of form of the model and the seamless character of the design brought forth in us a sense of endless partnership, of evolution, of movement toward harmony and balance. For us, this represents the healing journey. People who seek an integrative approach to health hail from many different perspectives and experiences. The image unites these different perspectives. Some of us come from the perspective and experience with the conventional medicine system. Others come because we're very interested in food. Others come because we've had a lot of experience with moving our bodies. And others come from mind, body, spirit disciplines, some of which have roots thousands of years old. If you feel like doing so, I invite you to stand for a minute so that we can experience a mind-body discipline together. Place one hand over your lower belly and the other hand over your heart. Ground your feet. Have your feet be about hips distance apart. Feel the support of the floor. And let your knees be a little bit soft so that you can relax into the sensation that the floor is really supporting your weight. If you feel comfortable doing so, close your eyes. On your next inhale, fill your lower belly, then your ribs, then your upper chest, and then exhale. Repeat this 3-part breath at your own pace of breathing. Notice your thoughts. Notice your energy. Notice your body. And when you feel ready to do so, open your eyes and take your seat. As you take your seat, notice how your sitting bones connect to the surface of the chair that you're sitting on. And keep your feet grounded to the floor and that sensation that the floor is supporting you. So as you settle in, continue to stay connected to your breath, and then take your left thumb and put it into your right palm and give it a little squeeze. Just enough so that your thumb knows it's being held. Continue your 3-part breath. At the moment, we are experiencing 2 ways of moving energy through 2 mind, body, spirit disciplines. One is connection to breath, conscious connection to breath, and the other is Jinshin Jitsu. Jinshin Jitsu is a mind, body, spirit discipline which originated in Asia about 4,000 years ago. When I first began exploring complementary and alternative medicine, I learned that a lot of things like yoga, tai chi, qigong, Jinshin Jitsu have these ancient roots, and I thought there must be something to them if they have endured this long. So keep holding your thumb. Perhaps you've heard of meridians. Jinshin Jitsu is one of the meridian-based disciplines. Meridians are energy pathways in the body. Like acupuncture, Jinshin Jitsu works with these 12 energy pathways, but instead of using needles like acupuncture does, it uses hand contact. One of the many reasons I like Jinshin Jitsu is that it can be experienced both in the way that we're doing it now, self-care, and you can also have a practitioner offer it to you, such as on a massage table. And since much of my medical career was caring for people that didn't have a lot of money to go to $100 an hour acupuncture appointments, I wanted to find things that I could offer to patients that they could learn to do themselves. Jinshin Jitsu is one of them. So during the rest of this seminar, and really in any situation in which you are not otherwise using your hands, you may practice self-care Jinshin by holding one of your fingers. So during the seminar, I'd invite you, after a couple of minutes with your thumb, move to your index finger. And a couple minutes later, move to your middle finger. And when you've made it through all of the fingers of your left hand, then take your thumb of your right hand and press it into the palm of that left hand. That finishes the sequence in the left hand. Then go to the other hand and make your way through the 6 positions, 5 fingers, one palm. So just do that at your pace and see if you can stay connected to that 3-part breath. Okay, belly, ribs, chest, exhale. In my early years as a physician, I mainly saw people who were ill and seeking help from within the conventional medicine system. They were entering the healing journey from that vantage point. The 2 top contenders in the competition among things that sicken and kill humans in the developed countries are cancer and heart disease. In 1930, heart disease replaced infectious disease as the biggest threat. And by 1940, cancer, which until then had occupied the 8th place, moved to number 2, and it has stayed there. What happened to create these shifts? Advances in conventional medicine improved health and lifespan through the development of antibiotics, vaccines, antimicrobial, and surgical procedures. Greater offerings in diagnostic testing allowed us to know better what was going on when people became ill. At the same time, we were becoming more sedentary, stressed, eating more and more animal and processed products, oftentimes while sitting at our computers or watching TV. These changes helped move heart disease and cancer to the top killer spots. During the 20th century, the conventional medicine system increasingly became a part of many people's lifestyles. We all raised our hands when I asked who has a doctor. I don't think anybody doesn't have a doctor these days, except for a 2013 Mayo Clinic report found that 70% of Americans take at least one prescription drug. In 2014, the FDA reported that Americans spent $31 billion on non-prescription drugs. Do you see this? The medical system is the 3rd most common cause of death among Americans. Right after heart disease and cancer, it is what is most likely to kill us. It's true that the medical system offers a vast array of medications, tests, procedures, and hospital experiences that help us when we have certain acute diseases. It also offers medication errors, which cause 1 death per day and injure 1.3 million people in the US annually, according to the FDA. Unnecessary surgery and testing, other preventable errors in hospitals, hospital-borne infections, and adverse drug effects contribute to injuries and deaths. So what does this say to us? For me, it says, like any risky venture, we should assess the risks and benefits of getting involved in that system. We engage the medical system when it is worth the risk to do so, and we stay away from it when the risk is too high. When we have acute disease, conventional medicine offers benefit over risk. Infections that used to kill us can now be treated with medications. This is an electron microscope image of bacteria. Conditions that require surgery, anesthesia, and sterile technique are now able to be cured. We can diagnose conditions with laboratory and imaging studies and get better understandings of what is going on when we're ill. Vaccines protect entire populations from epidemics that used to be a part of what we expected would kill or maim us. Conventional medicine is part of our definition of integrative health because it is uniquely able to cure disease, acute disease. Many acute diseases no longer kill us because of the miracles of modern medicine. It's important to know the place that conventional medicine has in our lives and not be looking for it to do what it cannot do. While it is uniquely miraculous in acute disease, it falls short with chronic disease. And the most likely health problems that we have are not acute, they are chronic. People now increasingly suffer from lifestyle-related conditions, including respiratory diseases, obesity, diabetes, allergies, arthritis, autoimmune conditions, chronic pain, sleep disorders, anxiety, and depression. And let's not forget the 2 top killers, heart disease and cancer. Chronic disease invites us to take more responsibility for our own health, and integrative health offers ways to do that through the food that we eat, the mind, body, spirit disciplines with which we engage, and the ways in which we move our bodies. So, if you feel like doing so, let's stand again. And take this position. So this time our legs are a little bit further apart than our hips, and our arms are up high. David, would you mind coming up here, please? So this is called extended power pose. Modern life has most of us sitting endless hours at our desks, watching screens and disconnected from our senses while relying predominantly on learning through our intellects. Okay, now go here. Wonder Woman pose, or Superman pose, depending on. The result, we often feel anxious, uninspired, and depleted. We may gain weight. We may develop chronic health problems. This is the movement part of the talk, so we're moving. Movement of the body is vitally important to regain balance. Every day needs to include some form of movement. Amy Cuddy is at Harvard Business School, and maybe you've seen her TED Talk. She learned in her research that moving into these power poses, and if you get tired here, you can take another one of the ones up here. She learned that moving people into these power poses helps people feel powerful. And she focused on people in stressful situations, particularly interviews, job interviews. So keep moving from one pose to the other as I ask you this question, and feel free to just share your ideas. What are some forms of movement that you engage in or you would like to begin engaging in? Just yell them out. Walking? Tennis? Yoga? Dancing? Tai Chi? Stretching? Cardio kickboxing? Kayaking? Cycling? Biking? Our bodies hold vast wisdom and intelligence, from the precise communication of our nervous systems to the power of our muscles. Moving our bodies helps us connect to that power within us. This is an exercise that you can do during your day. Even doing it for a few minutes is beneficial. Amy's research showed that if people before a job interview go into the bathroom and stand like this, that it helped them do better in their job interviews. So watch what you see going on in the bathroom. So let's come back here and just bring our 3-part breath back in. Feel your feet grounded to the floor. And go ahead and resume your seats when you feel ready. And pick up your finger holds where you left off. What sort of food do we recommend in an integrative approach to healing? We recommend eating a diet primarily comprised of plant-based whole food, like my daughter told us to eat when she was 5. Specifically, this includes whole grains, legumes, fruits, vegetables. Our food recommendations are motivated by science that has come forward since we were growing up in the 50s and 60s. These include public health studies that look at what people eat and what diseases they get, and science that helps us understand the process of inflammation in the body. Our learning began with one book that changed our lives. The information I'm sharing with you now is in your handout that you'll receive at the end of the session. And I would encourage you to consider reading some of the materials that have influenced us and see what you think. The China study was published in 2006. When I read this book, I was horrified to realize that it recommended a very different nutritional approach from what I had learned and was using with my patients. My learning had come from governmental guidelines, from the AMA, the American Medical Association, and from my parents who had taught me what a balanced meal was. In medical school, we got no courses in nutrition, 0. And I'm sorry to say that 35 years later, it hasn't changed that much. The China study emerged from a collaboration among 3 academic medical centers on 3 continents, studying populations in rural China over many years. And they chose rural China because they wanted a population that stayed put so that they could really study them. The book was co-authored by Dr. Colin Campbell and his son Tom. Many additional studies are now available which confirm the findings that a diet comprised mostly of whole plant-based foods is good for promoting health and reversing disease. Remember the 4 food groups? These were very, very easily understood recommendations that most of us grew up with. They were so simple. You could look at the poster and pretty much instantly assess whether your meal was adequate. Are you eating some meat, dairy, fruit, vegetables, grain, bread, a steak, rice pilaf, green beans, and a glass of milk was a perfect meal. And that was immediately obvious. Tom Campbell, who co-authored the China study with his dad, makes thinking about food groups even easier because he proposes 3 instead of 4. Tom suggests that we can categorize most things in the grocery store into one of 3 food groups: animal products, processed plant fragments, and whole plants. He suggests we ask 2 questions. Is this product from a plant or an animal? And if it's from a plant, is it similar to what I could find on a tree, a bush, or in the dirt on a farm? So let's see what we think about a few examples. This is cheddar cheese. Animal. Animal. Processed from the milk of a cow, so it's an animal product. Plant fragments. It's not an animal, doesn't resemble any plant you'd find in the dirt on a farm. So it's a collection of processed plant fragments, including sugar, flour, and oil. Plant. The animal group and the whole plant food group, those are easy. It gets a bit trickier with the processed plant fragment group. So what do I mean by processed? Being processed means that mechanical or chemical steps were taken to isolate certain components of the original plant. So let's start with a whole sugar beet pulled from the ground, and now we ship it off to a processing plant. It's sliced up, the pieces are put into a diffuser machine, water helps to separate the sugar from the fibrous material or the pulp. The pulp is sent away to become animal feed. The raw juice is combined with certain chemicals to remove impurities, and then gases may be bubbled through the juice to remove more impurities. Then the liquid goes through further processes of boiling, drying, crystallization, and you end up as the final product, sugar. Through processing the beet, almost all the components and ingredients of the original plant are stripped away until we just have sugar, a single fragment of the original plant. Notice the packaging. Pure, natural, real. On your handout are names of authors and scientists whose work you could also consider getting to know the way we have. With the time we have here, my main message is to encourage you to do as we have done and get educated. Because as of yet, the science is not taught in most medical schools, nor in most U.S. nutrition programs. The reasons for this are primarily political and economic, and those themes are explored in the films Forks Over Knives and excuse me, and Plant Pure Nation. Michael Pollan is an American author, journalist, activist, and professor of journalism at UC Berkeley Graduate School of Journalism. Have you heard his saying, eat food, not too much, mostly plants? Anybody heard that saying? Yeah. His Food Rules book has 64 rules, and these are 5 of my favorites. Number 2, don't eat anything your great-grandmother wouldn't recognize as food. Number 6, avoid food products that have more than 5 ingredients. Number 11, avoid foods that you see advertised on television. Number 19, if it came from a plant, eat it. If it was made in a plant, don't. Number 21, it's not food if it's called by the same name in every language. When we created International Integrators, whose mission is to promote integrative health globally, we intended it to be an organization made up of people from many countries and many professions and many backgrounds. As such, we welcome your involvement. We have a number of activities with which you can become involved. One is that we look for integrative health projects that need support, and we find that support. At the moment, there are 3 that we are actively involved with. The Children's Oral Health and Nutrition Project is currently active in 10 countries. The project focuses on people, especially children, whose health has been adversely affected by the processed food industry. This organization was begun by a physician in California, a professor of medicine at UC Berkeley and UCSF, who was a volunteer in the Peace Corps when she was a young woman in Ecuador. And 20 years later, she returned to her little town. And what she saw was all the children who used to have beautiful white teeth now had rotten teeth. And she saw a little shack in the village that had been clearly placed there by the Coca-Cola company. It was filled with Coca-Cola and a whole bunch of packaged food. And in those short 20 years, the diet of those people had shifted from their traditional eating patterns to stuff that was really easily accessible by ripping open bags. She was horrified to see that the Coke was less expensive than the bottled water in the store, and that mothers were putting Coca-Cola into the baby bottles of their children. So she started this project. It's now in 10 countries. It brings care to these rural communities and teaches local healthcare workers and parents about prevention and treatment. There are many ways you can get involved, including opportunities to volunteer for a team visit. RANA is an organization that brings sexual abuse prevention services to schools on Mallorca. We were able to bring funding from the Alec Baldwin Foundation to assist this organization. Cuatro cosas is a term in Spain that literally means 4 things. but figuratively means a few things. So if I ask you over to dinner, I might say, come to dinner, I have 4 things I want to show you that I did to my house. Doesn't necessarily mean 4 things, but everybody says cuatro cosas over there. So we started 4 projects. A restaurant project that encourages restaurants to add at least 4 whole food plant-based items to their menus. A school project that encourages schools to teach children about health, environment, and animal welfare considerations of a whole food plant-based diet. A hospital project that encourages hospitals to improve their food offerings. I know that nobody here agrees that that might be necessary. And a home project that encourages each of us to do 4 things that move us in the direction of eat food, not too much, mostly plants. We write and publish weekly blogs and are happy to collaborate with you to publish something of interest to you. If you would like to receive our blog, just speak with us personally or sign up on the website. And as Dr. Leary mentioned, we also offer 5-day retreats in which we can immerse in an integrative lifestyle, focus on self-care and wellness, and discover how our bodies, minds, and spirits feel when supported in this way for 5 days straight. Our next one is in June in Avila, Spain, just an hour north of Madrid, if anyone has any free time. We have a few spots left. And if you're interested in knowing more, please speak with us afterwards. Many years ago, the infinity sign came to me in a dream, a powerful dream. And in the days that followed the dream, I explored what the symbol meant. Connection, evolution, possibility. The more I worked with the symbol, the more I realized it was helping to guide me to develop an integrative approach to my health that I could share with others. The approach brings together the best in conventional medicine, food, movement, and mind-body-spirit disciplines. Looking at health this way allows us to connect with the power that is within us to heal, and the power that is within us to connect with others with whom we can form a health care team. The team may be made up of professionals, friends, family members. No matter who we choose to join us, we are the central member of our healthcare team. Place one hand over your heart, your other hand over your lower belly. Feel your feet grounded into the floor. Feel your sitting bones connected to the chair. Bring in that 3-part breath again. Belly, ribs, chest. Exhale. And if you feel comfortable doing so, close your eyes. Breathe in these thoughts. I am learning. I am teaching myself new things. I am aware that I have power within me. I am connecting to my inner healer. I am connecting to the doctor who lives within me. And when you feel ready to do so, come back into the room. I believe we have time for some questions and discussion. So I think the way we'll do this is I'm going to go there with my microphone so that everyone can hear your question.
My question is, soy products, how would it
into that, the three categories, because most of them are processed? Thank you.
Thank you for your question. The question is, soy products, most of them are processed. How does that fit into the way that we think about food? It's an excellent question. Soy is a complicated product because of exactly what you said, that it's processed. The way that we're approaching it at the moment is we're keeping track of the literature and the research that's being done. A lot of research is being done on this question. And we're sticking with non-processed soy in our personal habits. So, and we use very little. So something non-processed that's a soy product would be, for instance, tofu. But we don't eat a lot of it. Tamari instead of soy sauce would be another example.
I can definitely appreciate your slant towards a vegetarian lifestyle, plant-based lifestyle, but do you ever take into consideration a ketogenic diet or the work of Mike and Mary Danides and their philosophy on protein power and how it readjusts glucose levels and addresses insulin? Because I work with a lot of progressive cardiologists that kind of encapsulate this integrative approach, and for people that swing to one side fairly heavily, a lot of them sort of implement and execute on a ketogenic diet initially, which would be almost in opposition to a plant-based diet.
Thank you for that question. And I can tell we need to talk more later. The issue of what kind of diet to follow, we could do a 5-day seminar on that alone. And so part of the reason, since this is very much of an overview talk, part of the reason that I decided to take this approach and then give a handout that has all my contact information is so that we can have deeper discussions about things. Is it okay if we leave it there for right now? And thank you.
I receive a lot of these pamphlets about different things to take for whatever you have, from heart disease to whatever, and diet. And what am I supposed to do with these? How do we assess the worth of what they're offering? Because the advertisement is pretty strong in favor. Boy, if you take this and personal support of it, you know.
Yeah. It's actually very much related to this gentleman's question, and it's why my emphasis here tonight is on self-education and self-care. Be careful of things that promise. I mean, when we talk about whole food plant-based, I'm not saying everybody should do it. I'm saying primarily move in that direction, mainly because as I read the research and I work with people and see what happens, I'm convinced more and more. And I've only been at this about 10 years in terms of this, although my daughter's 32 and she made the switch when she was 5. So I've watched her, she's raising her 2 and almost a third children, my grandchildren, this way. We have an 11-year-old grandson who's been raised this way. And so, you know, I have these experiences. Trying to sort out the science from the hype is one of our big challenges in modern life right now. And it's something that I think we all need to just have a lot of thought about. I think it's wonderful that you carry these things to this discussion so that we can really look at what we think actually makes sense. One of the guiding principles that I have is, how long has it been around? How long have the therapies been around? When I taught Jujin Shinjitsu, that's been around 4,000 years. Somebody mentioned yoga. That's been around about 2,500 years. Eating plants is what most people have done over the course of all the millennia that humans have been on the planet. If they got lucky, sometimes they killed a buffalo and the whole community ate it for a little while, but then they went back to plants because that's what was around. And so I like to look at the historic perspective of things. So I don't know what's in your pile, but an awful lot of these types of things that I see are fairly newly generated things. And a lot of them tend to be generated in laboratories. And so that hasn't been around so long. We haven't had so many years of laboratories. So that's kind of a philosophical discussion that I have. But if there are specific ones that you want to talk about, let's talk after.
As part of the integrative health, we have mind, body, spirit. I was just wondering, do you have like a daily practice that might include meditation or whatever?
Thank you. Yes. Jinshin Jitsu for me brings in meditation. Being in conventional medicine and having a really crazy career for many decades, I found it impossible to go from that to sitting quietly on a pillow and trying to clear my mind. It didn't work for me. I needed to be doing something physical with my body. And so Jinshin helped me with that because it had certain places that I put my hands on my body, which then allowed me to focus on breath and other things. So over the course of practicing it, you actually do meditate, but it's not transcendental meditation. I mean, there are a lot of forms of meditation, and it's not going to that immediately. That's just what I needed for my process.
Thank you.
Sure.
Do you believe food addiction is a real phenomenon, and especially regarding processed foods, sugar, corn syrup, etc.? And if so, how does one get over those type of addictions?
Thank you for the question on addiction. So the question is food addiction a real thing, and especially relating to processed foods? And there's a lot of really persuasive biochemistry that helps us know that certain receptors in our bodies have particular affinity for certain types of things. It's why I think what happened and why the Children's Oral Health and Nutrition Project is needed, that in 2 decades you can take a people that ate plants for their whole history and you can make them sick because you give them fat and sugar and salt. So to the extent that it's an addiction in that way, in that chemical way, yes. For me, having grown up in medicine in the 80s when addiction became a medicalized phenomenon, so we started calling alcohol an addiction, drugs an addiction. That was my training, was to think of those things as diseases. And we created a medical model for that. I now take a different approach to that. And I think of it more as we're all living with a lot of pain, and we need to seek relief from that pain. And we have various ways that we do that. Food is one way, alcohol is one way, drugs are one way, shopping, gambling, screens. And there are a lot of different ways that we seek relief from our pain. And so I like to work with the root and go to the pain. So the question is, how can we bring an integrative approach into a group home that has people who have disabilities, developmental disabilities? One of the things that I have loved about learning about energy work, and I only talked to you tonight about Jinshin Jitsu, but there are lots and lots of ways that we can help people move energy, is that it works incredibly well if we get our minds out of the way. So when I work with this population that you are working with, I find it even easier, actually, than to work with somebody who's got a PhD, especially engineers. takes longer. And so one way that I really like is Genshin Jitsu because it's very simple and it feels really good to people. Most people have a deficit of touch. Most of us do. And so it's a way of touching that is therapeutic and helpful. And people respond very quickly. I was talking to the students at lunchtime and explaining to them in these 10-minute visits that I used to have as a doctor that I could, Sharon, can I take your hand for a sec? I could come into a room and just shake someone's hand because they expected that a doctor walking into a room might do that, so it was okay to touch there. And then I could transition into a conversation about why they came to see me, and I could just move and hold the thumb. And we could talk, and I could learn more, and then maybe I would examine, and maybe I would move to the finger. And by the end of the 10 minutes, I would have gone through a few of the digits, and then I could say, do you feel any different from how you felt when you first came in here? And inevitably, they would say, yeah, I do feel different. I'd say, well, you know, try going home and doing this, and then come back and see me next week, and I'll teach you something else if you like how this is. So does that, can you imagine doing some of that? And in the handout, you're going to see some good books and online resources that can teach you very simple things that you can do with the folks that you're working with.
I just have a question about why we have seen an incredible rise in food allergies of late. In particular, we all grew up eating peanut butter and jelly, and now almost every child is allergic to peanuts.
Yeah.
And I'm wondering why that is, or if you have any ideas about why that is.
Yeah. So the question is about why there's an increase in food allergies. And I can't quote science for you on this. It's, my answer is going to be more of a Gestalt kind of answer, more of a sense of things kind of answer. But I think we're living in a culture now where there's an awful lot of assault, foreign assault on the human body, whether it's air pollution, impurities in our water, and probably the biggest thing from my point of view is the amount of stuff that we eat that isn't really food, and that most people are not aware of, at least in my experience when I work with people. People are not aware of how much stuff they put in their bodies that has more than 5 ingredients and comes from a plant, wasn't made in a plant. In addition, there's a lot even in the plant world that's genetically modified now, especially here in the United States and increasingly in Europe. And that's a big concern. We don't know what this genetic modification is doing, but there's a suspicion among some people who are trying to research this that it may be causing our immune systems to be revved up. And as you all appreciate, the immune system is meant to protect us from foreign objects, whatever the immune system decides is foreign. And so if the immune system is in a state of being revved up, it will be activated against many things. So part of the reason that we try to move people to anti-inflammatory diets is so that the immune system can calm down and relax, and then we can see how to move from there in terms of the healthcare process. Yeah, the question is, what do I eat? And if you go onto our website and look at our blogs, we give very specific guidelines and also some really delicious recipes. So the food we eat in the morning is a food called kanji. It comes from Asia. We learned it from an acupuncturist a few years ago. And ours is a grain-based that stays away from the genetically modified foods, so it means that we don't eat gluten. So we make a mixture of millets, steel-cut oats, various quinoas, various brown rices and other rices, and buckwheat. which sounds like it should be a week, but it's not. And we cook it in a slow cooker with a bunch of spices. And then we make what we call a congee sundae. And we put nuts and dried fruits and fresh fruits on top. And we use a grain or nut-based milk. And that, we find, serves us all day. We don't really eat again until evening. And then we have a lot of different fabulous recipes that you can read on our blog.
Thank you. Could you talk a little bit more about the results of the China study? It's a book that's been on my to-do list. A number of my family members have read it and trying to get everyone in our family off of milk. But when I look at the explosion of almond milk products, they're filled with guar and all kinds of ingredients. So can you talk a little bit about that?
I would love to talk about the China study right now, but I think I'm going to answer you the way that I answered this gentleman here, and we'll need to talk offline about it because it's another thing we could talk 5 days about. The quickest way to learn about the China study is to see Forks Over Knives and see Plant Pure Nation. Both of them come from the same producer, and they give you a very good synopsis of that book. So in 4 hours you can get it. But it's a very powerful book. In terms of the ingredients that are in the various nut and grain milks, there are a lot. The one to be most worried about is called carrageenan. Don't buy products with carrageenan in them. I'm now starting to see in the United States labels that say carrageenan free. So they're even getting to that. But I mean, the safest way to do nut and grain milks is to make them yourself, to soak the seeds or the nuts and then put them through a blender. That's what we do. It's not that hard. But if you're in a rush, at Trader Joe's, I am told, I haven't gone there, but I'm told that there are some relatively clean milks, and also at Whole Foods. How much more time do we have?
Two more?
Two more questions, okay.
I'm involved in competitive kickboxing. I'm on the Muay Thai circuit. I'm hoping to go amateur this year and pro someday. I follow a very strict lifestyle. Every single day I get up, I run 3 miles, 6 days a week. I train 2 hours a day. I eat vegetables, chicken, rice, drink tea 7 times a day. It's very, very rigorous. No fast food, no cakes, no dessert, no crap. My biggest thing is I don't tell someone to do something that I don't do myself. So I don't just preach it, I do it. And I've helped a ton of people lose weight, change their lives, better themselves. My biggest frustration is I bet half the people in here are gonna go home and pick up a piece of cake and put it in their face. How do you really get it to stick with someone so when they leave here, they're gonna actually change what they're doing? Because I feel like for me, it was discovering that I loved myself, that I wanted to change because I actually cared about myself and wanted to be the best person I could possibly be. But unless you have a very powerful reason, like for me, Muay Thai, kickboxing, you're not really gonna change those bad habits. How do you get people to change? I mean, really change those habits?
Thank you for that question. I think I have to say that I don't see myself as somebody who gets people to change. I offer what I've learned and what I think is important, and I stay open to learning new things all the time. And I try to meet people where they are. I think people eat sweets and sugar and salt and fat for a lot of different reasons. Not just because it tastes fantastic, but because there's associations with childhood experiences that make them feel good, because they're in pain and they know chocolate makes them feel a little bit better. Maybe they have menstrual cramps. I mean, there are a lot of reasons that people do things with food. And you know, if we were to open this discussion up to food, we could go on here for a couple of days. I think your point about finding something that really matters to you is an excellent point. And that's really, I hope, one of the things you took away from the things I shared tonight is that self-care, self-growth, self-discipline, self-development is at the core, from my point of view, is at the core of our journey. I also think, for me at least, it's really important not to judge anybody about anything. We're all doing the very best we can. And at the same time, we're trying to read things and learn things from one another and grow at our own pace. Each of us has our own pace of growth. As a mom and a grandmother, one of the hardest things I've had to learn in life is that I can only know what I know when I know it. Sounds easy to say. I haven't found it all that easy to live it. But it's helped me to be caring of myself and my pace of learning things. And it's helped me as I've worked with others who come to me to ask me for guidance.